New data from the Centers for Disease Control and Prevention shows the rate of children being diagnosed with autism in our country is steadily rising. And that's been the case since the year 2000. In today's Your Healthy Family, I'm showing you the latest numbers.
He would not waste the second fig.
In 11 communities across the country being monitored by the CDC, more kids are being diagnosed with autism spectrum disorder.
2.8% of children, or 1 in 36, were identified as having autism.
But Matthew Maynor, chief of the Child Development and Disability Branch of the CDC, says 5 years ago in those same communities, 1 in 44 children were diagnosed with autism by age 8. That's up from 1 in 150 children in 2000.
Black, Hispanic, and Asian Pacific Islander children had a higher prevalence of autism compared to white children.
The CDC believes the rising numbers don't necessarily mean there are more kids with autism, but that screening tools are catching more cases, especially in minority populations.
Children with autism are a significantly underserved population in our country.
But pediatric psychologist Eric Butter says this data shows we're heading in the right direction when it comes to diagnosing autism.
The health equity and disparity issues are beginning to show some promise.
Early detection is key. The Autism Speaks organization says treatment has a greater impact when children are young.
This report also is a call to action for us to develop more culturally informed intervention services that are able to meet these families where they are at.
Another CDC report shows the U.S. suffered some setbacks in early detection of autism during the height of the COVID-19 pandemic. Researchers say this data may help communities come up with ways to help children who got a delayed autism diagnosis because of the pandemic as they got older. For Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.